Alright, guys, today let's talk about the major branches of psychology. Psychology can be roughly divided in two major areas: research, which seeks to increase our knowledge base, and practice, through which our knowledge is applied to solving problems in this real world. Firstly, let's mention abnormal psychology. Abnormal psychology is the area that looks at psychopathology and abnormal behavior. Mental health professionals help assess, diagnose, and treat a wide variety of psychological disorders, including anxiety and depression. Counselors, clinical psychologists, and psychotherapists often work directly in this field.
Behavioral psychology, also known as behaviorism, is a theory of learning based on the idea that all behaviors are acquired through conditioning. While this branch of psychology dominated the field during the first part of the 20th century, it became less prominent during the 1950s. However, behavioral techniques remain a mainstay in therapy, education, and many other areas. People often utilize behavioral strategies such as classical conditioning and operant conditioning to teach or modify behaviors. For example, a teacher might use a system of rewards in order to teach students to behave during class. When students are good, they receive gold stars, which can then be turned in for some sort of special privilege.
Let me introduce about biopsychology. Biopsychology is a branch of psychology focused on how the brain, neurons, and nervous systems influence thoughts, feelings, and behaviors. This field draws on many different disciplines, including basic psychology, experimental psychology, biology, physiology, what else? Cognitive psychology, and neuroscience. People who work in this field often study how brain injuries and the brain disease impact human behavior. Biopsychology is also sometimes referred to as physiological psychology, behavioral neuroscience, and psychobiology.
Clinical psychology is the branch of psychology concerned with assessment and treatment of mental illness, abnormal behavior, and psychiatric disorders. Clinicians often work in private practices, but many also work in community centers or at universities and colleges. Others work in hospital settings or mental health clinics as part of a collaborative team that may include physicians, psychiatrists, and other mental health professionals.
Let's try to understand a little bit about cognitive psychology. Cognitive psychology is the branch of psychology that focuses on internal mental states. This area of psychology has continued to grow since it emerged in the 1960s. I think so. This area of psychology is centered on science and how people think, learn, and remember. Psychologists who work in this field often study things such as perception, motivation, emotion, language, learning, memory, attention, decision making, and problem solving.
Comparative psychology is the branch of psychology concerned with the study of animal behavior. The study of animal behavior can lead to a deeper and broader understanding of human psychology. This area has its roots in the work of researchers such as Charles Darwin and George Romanes and has grown into a highly multidisciplinary subject. Psychologists often contribute to this field, as do biologists, anthropologists, ecologists, geneticists, and many others.
Counseling psychology is one of the largest individual subfields in psychology. It is centered on treating clients experiencing mental distress and a wide variety of psychological symptoms. The Society of Counseling Psychology describes the field as an area that can improve interpersonal functioning throughout life by improving social and emotional health, as well as addressing concerns about health, work, family, marriage, and much more.
Cross-cultural psychology is a branch of psychology that looks at how cultural factors influence human behavior. The International Association of Cross-Cultural Psychology was established in 1972, and this branch of psychology has continued to grow and develop since that time.
Developmental psychology. Developmental psychology focuses on how people change and grow throughout life. The scientific study of human development seeks to understand and explain how and why people change throughout life. Developmental psychologists often study things such as physical growth, intellectual development, emotional change, social growth, and perceptual change that occur over the course of the lifespan. All these psychologists generally specialize in areas such as infant, child, or adolescent, or geriatric development, while others may study the effects of developmental delays. These fields cover a huge range of topics, including everything from prenatal development to Alzheimer's disease.
Experimental psychologists work in a wide variety of settings, including colleges, universities, research centers, government, and private businesses. Experimental psychologists utilize scientific methods to study a whole range of human behaviors and psychological phenomena. This branch of psychology is often viewed as a distinct subfield within psychology, but experimental techniques and methods are actually used extensively throughout every subfield of psychology. Some of the methods used in experimental psychology include experiments, correlational studies, case studies, and naturalistic observation.
Forensic psychology is a special area that deals with issues related to psychology and the law. Those who work in this field of psychology apply psychological principles to legal issues. This may involve studying criminal behavior and treatments or working directly in a court system.